Welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Ann McCurdy, and in today's episode, we're getting to know orthopedic surgeon Dr. Chuck Rosipal. Before we get started, 2 quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Thank you so much for making time for us today and letting us get to know you a little bit.
Yeah, it's nice to be here.
So we get to start out with a really tough question. Tell us a little bit about yourself.
Sure. I am originally from Austin, Texas. I came after medical school. I came to University of Nebraska Medical Center / Creighton University Medical Center for residency, vowing to go back to Texas. I made one slip up and married a beautiful Nebraskan, and now it looks like my life will end here in the Midwest, and I'm fine with that. And then after that, I tried to take her, the Midwestern girl, back to Texas. So I did my fellowship in shoulder surgery in Texas, but I did have a strong pull to bring us back here. I had a good job with a group out of Omaha, which is where I'm currently employed and doing outreach from. And so here I am today.
How about any hobbies? Or do you have a favorite exercise or a favorite way you get moving?
I enjoy outdoor activities like golf, hunting and fishing. Did a lot of that when I was young. I don't have as much time for it right now, just not only with a busy practice, but also with 2 teenage daughters that are involved in a lot of activities. My hope is that in a few years when I'm an empty nester with my wife, I can not only travel more, but get back to some of those hobbies that I enjoy.
Excellent. I was going to ask, now you're a shoulder guy. So do you have a favorite shoulder exercise?
I think anything that maintains mobility. So I have a stretching program that I provide patients in the clinic. It's also probably linked in our website, or if it's not already, I'm going to ask you to do that for me, Ann.
We can totally do that. We'd be happy to do that.
It's a home stretching program as well as a strengthening program. Basically goes over the cardinal movements of the shoulder, which are forward elevation, external rotation, internal rotation, as well as a pendulum exercise. I think no matter what your diagnosis is in the shoulder, if you can fall back on some of those exercises and work on flexibility, it'll always improve your quality of life and your ability to sleep.
Okay, so that mobility of the shoulder is what's really important. Okay, we will get that uploaded and make sure it's linked so people can check that out.
Awesome.
How about a favorite team? The Texas guy moves to Nebraska. Ooh, is it a divided household?
I have to be careful knowing that I'm in Hawkeye and Husker country, but
and a lot of Cyclones.
You're exactly right. And I grew up in Austin, Texas, so I've always been a Longhorn fan. I also like professional sports, and the Houston Astros. Haven't gone to medical school in Houston, but also we're team physicians for Creighton. So getting involved with the athletes at Creighton, from basketball to baseball, softball, soccer programs, volleyball, you name it. We spend a lot of time with those athletes, and so you really get to want to root for them as well.
Creighton, of course, is a local favorite, especially with Ryan Hawkins, local basketball player, being from here. So,
sure.
So safe answer to go with the Blue Jays.
Awesome.
We'll talk about Texas later.
Mm-hmm.
If you're cooking dinner to impress, what are you making?
I don't generally cook a lot of dinner to impress, but if I were in that scenario, I'd probably want to be cooking or grilling some type of item. I like to think that I'm pretty good at steak and fajitas and some of the other different things that you can grill. I also like to smoke meat, so brisket, pulled pork, all those types of things I really enjoy. So it'd probably be something like that as opposed to trying to do some fancy French cuisine or something to that degree. It's probably going to be back to the roots in Central Texas and grilling something.
Makes perfect sense and sounds delicious. So you do have some driving back and forth here between Omaha and Atlantic. What do you listen to in the car? What's your favorite? What do you jam out to?
I'm a country guy. So today, for instance, was George Strait on the way here, and I think on the way home it'll be maybe some Ella Langley and Zach Bryan.
Excellent choices. And you got to choose the king.
Oh, yeah.
Right?
You start with George Strait, the rest of your day is going to go good no matter how long, who you listen to.
That's perfect. Do you have a favorite holiday?
Because of my daughters, Christmas is very important to them. My 13-year-old starts singing Christmas carols. Probably it's July now, so she'll probably start now. But I like to see the excitement in their face. I do like to see my children also want to be givers around that time as well. So I'd probably say Christmas. It's also, the birth of our Lord, and I've always, as been raised Catholic, that's always been important to me. So not only sort of the family aspect of it, but also the religious aspect of it is important to me as well.
Love Christmas. And yeah, seeing that with your daughters, you're right. As a parent, there's just no better feeling. Mm-hmm. How about books, movies, podcast? Are you a book guy? Are you a podcast guy, a movie guy?
I'm not a podcast guy. I will probably never listen to this podcast, but maybe my children will. That's just not my cup of tea, But on vacation, I like to read books kind of the old-fashioned way, not like a Kindle or something like that.
You want a paperback or a hardcover?
I want, something in my hand that I'm flipping pages. Like it feels like a sense of accomplishment that you can see how many pages you're through. And then movies, probably older type movies, the classics and what have you. But no, when you have time, a book or a good old movie is where I'd want to be.
How about next or dream travel destination?
Phuket, Thailand.
Okay, that was a quick answer. Oh, yeah. It's been on the radar for a while.
It has been. And the interesting thing, and particularly with the internet, when we were young, and I'm old enough to remember Encyclopedia Britannica, and it's just so far-fetched now. I was trying to explain that to my kids the other day. Yeah, there was these books that sat stationary, and the information did not change, and you'd use them for 15 years and think that it was up to date. We were so sheltered by that. Maybe it was good, maybe it was bad, but now you can just see so many beautiful places that there are on Earth. And wanting to get out of the Midwest or wherever you live and experience some of those places. Just the visualization of it. I don't care about what I'm doing there, but just being able to kind of be like a camera taking a picture with your mind. Phuket has always been on my radar, and it's just a place that just has infinite beauty. There's a ton of other places I'd like to go, but that's one of the places that I would like to go to sooner rather than later.
That's probably one of the most unique answers I've had. Mm. So, very interesting. Yeah.
I could have said Hy-Vee, but
I mean, Hy-Vee is great too. But Thailand sounds more interesting.
Yeah.
We'd like to know a little bit about why you chose your career. Was there a moment you knew you were going to be a doctor? And was there a moment where you knew orthopedic surgery was right for you?
It's interesting. I answered this question the other day by chance because I have two daughters at, like I said, 13 and 16. Both of them are interested in some form of medicine. And they were asking me a bit about, why shoulder, why orthopedics, etc. I was lucky when I started. I was the only physician in my family. I wasn't a son of a doctor. I had no preconceived notions. I had no expectations of me. So when I found medicine, I first wanted to be a physical therapist, but when I found medicine as the direction I wanted to go, then I had to decide, well, do I want to do internal medicine? Do I want to do surgery? So I kind of tried to immerse myself in that, not having had previous exposure prior to medical school. It was on me to discover what would be fulfilling for me. And so I found that I liked surgery. I liked the technical aspect of doing something with my hands to then change an outcome. And then as it sort of warped into, okay, orthopedics is my path, then I had to find what within orthopedics I wanted to do. And the interesting part is that when I looked at the different body parts in orthopedics, whether it's hip and knee or foot and ankle or hand and wrist or spine, Shoulder was one of the joints that it seemed like the more I researched and read about it, the more I felt like I still had more to learn. So I wanted to pick something that would keep me learning for the rest of my life. I didn't ever want to feel stagnant. I didn't want to feel like I was just treating a hinge. I wanted something that was going to be complex and that I always could grow and always could learn. And that's kind of how I ended up where I am today. And it's very fulfilling. It's very rewarding and still at times perplexing, but I enjoy it. And that's what I told my kids. I don't care what you wind up doing. I don't care, if you're the president or you're a ditch digger. As long as you enjoy digging that ditch, you go and do what you want to do. But that's what I've been able to do, and I'm happy with it.
It's very true that, being open to those new ideas, being open to a career where you are able to keep growing and you're not doing the same things over and over, knowing those things about yourself makes a huge difference probably in your contentment with what you're doing and your experience with patients too.
For sure.
How's your experience been at Cass Health so far?
Oh, it's been awesome. I had been working in the Omaha area for about 19 years at similar clinic locations. I do go outside of Omaha to the north a bit to Fremont, but it's still pretty close. But it's kind of a known entity. So both of my parents grew up on farms in Texas. Both of them were really from immigrant families. They spoke Czech before they spoke English. So coming out into a more rural area is very rewarding because it almost feels like, even though it's not the same area, it is still the same people. It's a lot of people that are in agriculture and have a small town mentality, which I enjoy. And it sort of refreshes me with sort of that contentment, not this chasing, a bunch of money in a big city, but people who can be content with the simpler things and the more enjoyable things in life. And I think that sort of is a nice little rebirth even for me. I don't always like an hour and a half here and back, but in the mornings it's kind of nice with the sunrise and kind of peaceful drive. On the way back, there's Council Bluffs and Omaha traffic, but I'll get over it.
Well, we're delighted to have you here, so thank you for making the drive. What should patients know about working with you, and what should they know about coming into an appointment with you?
I think what they should know is that I want to treat them just like if they were my family. It's important that, I tell this to my patients sometimes, 85% of what I do is as an educator. It is my job, like a good waiter at a restaurant, to explain the menu to you and what the options are and what everything is and how we can affect it. If you don't understand that, if you're the type of person that for some reason when you leave the office you don't know exactly what just took place, that hurts me. Because as an educator for that 85%, I want to make sure you understand what we're doing, because you're the captain of the ship. This is your body. You're the one that needs to be happy at the end of the day. And 15% of my job is as the technician, okay, the carpenter, if you will. And I take that very seriously. I learned at a young age that sometimes the way health information in particular would get filtered down to me, Aunt such and such had this, and the way it went through 2 or 3 people, and it was confusing as anything. I want to make sure that I'm never using, the $1 million word that goes over someone's head. I want to try and simplify things so that you understand what's affecting your health of your shoulder and how we can improve that. Just want people to know that, I always want to make sure I'm available to answer your questions. If you come and see me, if there's something that's unclear afterwards, don't be afraid to ask. People are sometimes taken aback that that I'll give them my cell phone number or something and say, text me, anytime. My partners, some of which would never do that. They want to separate things, and I can understand that. But at the end of the day, I sleep better knowing that my patients are comfortable, or that they're happy, or that they understand that I care about them.
We love that. Well, Dr. Rosipal, thank you so much for being on the Cass Health Podcast. I think we're going to definitely do a follow-up podcast because we'd love to know more about shoulders.
Sounds good. Thanks for having me. I appreciate it.